Hello, Dr. Yuan Declare. Welcome to Deep Into Sleep podcast.
Hi, Yishan. Thank you so much for having me. I'm very excited to be here today.
Me too. So I know you are expert in working with a lot of women about their sleep problems. So first, I'm really curious. You told me you grew up in Taiwan, then moved to America. How did you decide to go into the field to be a sleep doctor?
Yeah, I mean, it wasn't a decision that came to me right away. So I grew up in Taiwan, like you said, and when I was 17, my to me, in looking back, it seemed like my parents made the decision to have my twin sister and they send us to the States for high school and college. So I came here for senior year of freshman. We were in Indiana. We went to Indiana University. And then there, my sister and I, we decided that after college, we wanted to do something completely different. Because growing up as twins, we're used to people always getting us mixed up. So she went to business and I decided to pursue medicine. I went to New York, the place at the time where I thought was up and happening compared to Indiana, at least. So I went to Albert Einstein College of Medicine, which is in the Bronx, New York. It is part of the five borough of New York City, but in my mind, I thought I was going to Manhattan. I didn't know the difference. So, in medical school, I was fascinated actually by uh, pulmonary, which is the lungs. The physiology was very interesting, and I also like critical care, which is very fast paced and taking care of critically ill patients. So I decided to go into internal medicine and then pursue subspecialty in pulmonary critical care. And during fellowship, which is where I had the additional training in pulmonary and critical care, we had as fellows, we had a lot of exposure to sleep medicine. Because even today, you'll see that most sleep doctors came from a pulmonary background. And that goes back to sleep medicine as it originally started. The disorder that people were interested in was sleep apnea, which was really a breathing issue during sleep. So in fellowship, I was fortunate to had a lot of training and experience in sleep, and that's how I became interested. It was just fascinating that something that seems to be an inactivity, something that we're not doing, but actually has so much impact on our life and on how our bodies work. So I decided to pursue another year of fellowship in sleep medicine. So that's how everything started.
Yeah, that's really a fascinating journey. And just like you said, yes, sleep apnea it's so interesting when we are asleep, right? We are not aware what's going on, but our body may have difficulties actually breathing.
Mhm.
And that I know that possibly impact a lot of our health, a lot of other things. And so I know you right now you work with women a lot. Your special interest is in sleep apnea among women. So, is there any difference between women and men when they have sleep apnea?
Yeah, there's actually a big difference, both in terms of diagnosis, symptoms, and the consequence of having sleep apnea. So first of all, symptoms. So when we think of sleep apnea, the general picture we have in mind is someone who's a man who's overweight, who's a little bit older and very tired and falling asleep. In women, the picture is very different. Usually the symptoms that women complain is not so much that they're sleepy or snoring, but it's more feeling tired, and sometimes could be mood issues like feeling depressed, uh, having anxiety. So because the complaints are so different, oftentimes it's the patient themselves may not be aware that it's a sleep problem. Uh, Other times it is the providers sometimes can miss the diagnosis. And so when it is diagnosed, we know that sleep apnea in women tend to be milder. So at least in terms of numbers. So sleep apnea, the severity is scored based on how many times the person stops breathing at night. So the more frequent, and then it's more severe. So women, it tends to be that the stopping breathing itself doesn't happen as frequently, but that doesn't mean that the symptoms that women experience is less severe. It's just on paper, the numbers looks milder, and that may translate to a difference in how women respond to treatment. Because from what we know is that for milder sleep apnea, usually there are more uh, treatment options. So the one option that people might be familiar or might have heard of it is CPAP, the machine, the mask. That's definitely a very effective, helpful treatment. But when it's mild sleep apnea, CPAP definitely works, but other things like oral appliance or some of these other devices or positional therapy, which is sleeping in different positions, can all work. So women um, need to know that there potentially there are more options for most women who have sleep apnea.
I totally agree with you about the diagnose part. As a psychologist myself, I can totally imagine if I don't have any training with sleep medicine or behavioral sleep medicine, if I don't know about sleep apnea very well, then women come in for mood situations, right? And they also not snore. And who gonna think that there
Yeah,
may be some other type of sleep disorder in the picture? A lot of women may complain, I'm tired because I have so many things. I have to take care of children, I have to work, and
right,
I'm depressed or I'm anxious. I may just go with there, like mood disorder. Okay, let's see how what we can do.
right,
But really, the big picture may be missed down there if there are sleep disorders in the picture. And
right.
also, if the number is low, I don't know whether there's any woman will look at that think, oh, I'm fine. This
Mhm.
is nothing. I don't need to do much about it.
Correct. Yeah, I think that is part of the complicating factor is it. So if the symptoms point towards sleep apnea, whether it's tired, it's snoring, but if they have that syndrome of sleep apnea, but the test number doesn't really support it, or it just mildly supports it, then is there a correlation between the two? And that's sometimes it's a matter of try and see. So it's a discussion that I would have with my female patients and just say, well, you're definitely very much affected by whatever problem you have. You're tired, you have memory issues, you feel fatigued. And the test here does suggest that there's some sleep disorders, there's sleep apnea maybe going on. I mean, I don't know how much the sleep apnea is contributing to your symptoms, but if we both agree, we might give it a try. Well, have you try treatment for for a certain period of time, 4 to 6 weeks, let's say, and then we'll see where you are at that point and go from there.
I like that. So sounds like if any of our listeners are female, if they're listening, when you check out, maybe you only have a mild sleep apnea, the number may be lower, but still worth trying different treatment options to try to manage the symptom somewhat.
Yeah, I think so. It's always, it's never, especially for women, it's not ever one thing that would make the decision. It's a combination of factors. So if the symptoms warrant um, treatment, um, then regardless of what the tests show, I mean, of course, if it shows everything's completely normal, then maybe it is something else. Um, and on the other hand, it's because treatment for sleep apnea, unless you're going for surgery, um, it's most of the time it's mechanical, which means that number one, it doesn't have a lot of side effects. And number two, when you stop treatment, we don't have to worry about rebound or other withdrawal type of effects. So it makes trying a more practical, reasonable option.
Oh, okay. Then if a female client or patient tell you that, well, I don't think this gonna, I'm just tired and that's manageable, right? What's that gonna do to my house? Do I really need to go through all this trouble, even though it's
Mm.
possibly not that um, bad treatment, but I don't want to consider that. So I'm wondering how sleep apnea may affect females' health. Do they do something to their health, even it's mild?
Mm. Yeah, that's a great question. So this is not just sleep apnea, but any sleep disorder. It affects uh, our bodies, and if we can look at it in two categories. One is medically. If we don't treat it, is it going to cause or result in any health issues? And the other part of it is quality of life. So if we don't treat it, um, if it then, how much of the sleep disorder that we found is related to these symptoms that you have that's affecting how you go about your day to day, and when we treat the disorder, is the reason to improve your health and or to improve your quality of life. Sometimes it could be both, and sometimes it could be just one of those two.
Oh, I really like this way of thinking, right? Quality of life and the medicine part of it.
Mhm. Right.
Mm.
So we do know, and the at least what we know so far, it does seem that mild sleep apnea does not have as strong as an association with these health complications as the more severe sleep apnea. So potentially we can say that if someone has just mild sleep apnea, then the reason to pursue treatment is less because of the health complications, but the potential of improving how they feel on a day-to-day basis. And it's not just how they feel, but we know that poor sleep also affects your your um, your performance at your work, and also your relationships, your emotion. All of that is quality of life.
Definitely. I think I interviewed some female guests before they have sleep apnea themselves. Sometimes took them more than 10 years to really got diagnosed.
Hmm.
But after they really received the treatment, some of them definitely felt like it changed their life and they
Hmm.
never feel so refreshed and so much energy. They always thought it like, fatigue, tired, low energy, just the normal. They're just different than
Right.
other people. But then when they find the right diagnosis, receive the right treatment, they did experience something different.
Yeah. Yeah, I do see that a lot, where patients come in because they've lived with the condition for so long. Part of what they feel is is become normalized, like you said, and they don't know, they don't remember what it was like, maybe in the very beginning, and it's only after they started treatment, then they're like, wow, I forgot this is how what normal is supposed to feel.
Right. Yeah, that's kind of sad when they are normalizing this negative experience, right? They feel like, oh,
Hmm.
that's just the story of my life.
Yeah, yeah.
I can only handle maybe half of the workload or family responsibilities than many other people or than my friends. It's just me. I'm just have a weak body, or I'm easy to get sick. I just easy to feel tired. But
Hmm.
if it's something they can improve, I can see that's such a empowering thing
Yep,
for themselves. Internally, they feel stronger, better about themselves.
absolutely. Yeah, yeah. And so I and adding on to what you said is it's and this is how insomnia can happen, is when they develop behaviors compensating for their poor sleep.
Oh,
So leaving a particular sleep disorder, in this case, we were if we're focusing on sleep apnea, but leaving one sleep disorder and treat it can oftentimes lead to something else. And now you have two sleep problems that's affecting sleep. So it makes sleep even worse just because one sleep problem was not addressed adequately in time.
that's a very good point. I haven't thought about that, but while you are talking, I can imagine someone, if they have sleep apnea, then they possibly have pretty poor sleep quality at night. No matter how long they sleep, during the daytime they are tired. I know a lot of time when people feel tired during the daytime, they tend to lay down, try to rest, and then they may fall asleep.
Huh.
So they nap quite a lot during the daytime. And what happens at night, of course, they're not as sleepy, right? Now
Yes.
they have difficulties falling asleep. And,
Right.
and once they fall asleep, they cannot breathe well. So the sleep quality is still low. And then
Yeah.
just repeat. I know for insomnia, a lot of people not only nap a lot, they also avoid social activities.
Mm-hmm.
Then they even don't move anymore. They don't see
Yeah.
people. They don't do physical exercise. They want to protect their energy. It just gets worse and worse.
Yeah. Absolutely. Yeah. So that's really then now the snowball is just rolling bigger and bigger.
Yeah. So talking about that, I'm very curious. I want to get your insight of that. When I treat insomnia, I sometimes quote the research and educate my patient that, women actually have higher prevalence of having insomnia
Mhm.
than men. Even though I quote this research and I know the percentage is much higher, it's like 2 times than men. But I don't quite know why exactly
Hmm.
is I read some research, but I want to hear more from you. Is that still true? Is that what do you think the reason or the science behind this? Why women are more likely to have insomnia than men?
Mm-hmm. Yeah, so it's definitely true. Women, it's a higher prevalence of insomnia in women, and women are at higher risk. And I think we can look at this from multiple different angles. So one of it is just it's being women, and by that I mean our bodies are not just smaller version of men, but it's completely different. The hormone fluctuations that every woman has to go through, starting at a very young age, starting at puberty, that's when we start to see differences between sexes in sleep, because hormone changes has direct impact on the sleep architecture, sleep quality, and people's subjective uh, sleep how they feel about sleep. So we know that periods can affect sleep architecture, where there's actually suggestion that there's less REM sleep when people have their periods, and there's definitely more awakenings. People wake up more, and maybe more nightmares, more fatigue related to having periods. So that's the monthly hormone fluctuations that every woman experience that can affect sleep, that can potentially cause insomnia. Then there is pregnancy. So, and I think we can just look at a pregnant woman, just physically, we know, we can understand how that can impact sleep because it's uncomfortable. And especially, as the baby grows towards the third trimester, research does show that sleep quality gets progressively worse through pregnancy. And not to mention the significant hormone changes in that time that can affect sleep. After the baby is born, it's definitely not the end of the story. And we know that sleep actually gets worse.
Yeah, that's feels like a start of a disaster for a lot of parents.
Yeah. That's actually a lot of times a lot of times it's actually the trigger for someone for insomnia. It's the hormone significantly now drops. Again, it's a dramatic change in hormone levels, and now there's a newborn. Now, so nursing and just adapting to the newborn's sleep schedule, now becoming a parent, all of that has directly impacts sleep. And then maybe when the kids are finally grown and the sleep patterns and sleep pattern maybe now more stable, the women start to go through menopause. So, and even though the average age for women in the United States of menopause is early 50, but we know that sleep problems related to menopause can start before that. And those are sleep problems like waking up at night, can't fall asleep, feeling fatigued. So these are what I look at are the three uh, hallmarks of how, because of being a woman, that these are the extra challenges that we face: menstrual cycle, pregnancy, menopause. Then the other lens that's causing this problem of women more prone to having insomnia is social factors. So women unproportionately are the ones who are responsible for carrying on the burden of unpaid labor. So we're caregivers, and at home as mothers or as wives. We know what we're talking about, and that all cuts into our sleep time physically, and also just the mental physiologic burden of playing that role, and that can cause insomnia, and that could contribute to insomnia as well. So it's really many different factors that that that's causing this issue of women and insomnia.
Right. Wow. Overall, just after you explain all that, I just feel like being a woman is so hard.
Well, yeah, I mean, it's hard. That's why we need each other to support each other. And that's why I feel that as a woman physician, that I have the privilege and also the responsibility to be in touch with this issue, and help women understand how we're different, and how we can, based on what we know, how we can address these issues.
Yeah, that's amazing work. I really admire you actually focus more on women's health and women's sleep health in general. Rarely I say sleep doctors or doctors in other fields distinguish it so clearly. Even when I study sleep related topics, it's not really, well, how we treat women, how we treat men. There's not a lot of guidelines, or these two genders are so different. But when you
Mhm.
really look at each disorder, sleep disorders, especially sleep apnea, there's a huge difference, and a lot of education need to be done to the public.
Mhm. Yeah. There's a huge difference, which we are just starting to know, because most of the medical research and even science research in general has used men as the prototype. And a lot of the things that we take for granted is actually based on men's bodies. So in focusing on women, part of it is based on intuition, just what we know, common sense, so to speak, that we just know it should not, it cannot be the same. And other part is with more and more researchers and scientists, doctors now starting to separate the genders and look at how these differences affect different disorders and treatment. And based on that, we can start to apply what we know on the problems that we have.
Great. I'm so happy that more doctors start realizing it, because just based on this limited information you shared, sounds like it's really should be treated differently, or the doctors need to have really different knowledge base to understand what's going on in each gender population.
Yeah, I mean, I have to admit, for myself, for a long time, I didn't appreciate or was aware of the difference, and a lot of it came from just being in the day-to-day grind of seeing patients and observing how men and women come in and oftentimes tell me very different stories. So, for example, one thing I observed is a lot of the men, the reason they come and see a sleep doctor is because their wives have complained. Their wives couldn't take it anymore. Um, Whereas the women are here because they they have been to different doctors, and their doctors have done all the different testings and haven't been able to come up with anything diagnostic. Then they think, well, why don't you see a sleep doctor and see if that they can come up with something that potentially may may explain you feeling so tired all the time.
That's so interesting, the motivation for men and women coming to treatment. I heard so many, even for me, I treat insomnia, right? If for men with insomnia, they don't snore, but still when they cannot fall asleep, they still impact their bed partners. So some
Mm.
men come to see me for insomnia treatment, also pushed in by their wives. Their wives cannot take it anymore to live with someone cannot sleep well and always complain about sleep.
Yeah,
So yeah, so I feel like even being a woman is very hard, but women are so important in
yeah,
our lives.
absolutely.
They are so important for each individual families, right? That's why the old saying happy wife happy life is so so makes sense.
Absolutely. And that's also why when we can help women get better sleep, it's not just the woman who benefits, but it's the entire family. And a woman being the backbone of our society. And really, it's the whole society benefits.
Yeah, totally agree. This is amazing. So, if our listeners are listening, no matter they're men, want to help their wives or their daughters, their girlfriends, or our listeners are women in general. So, do you have any last wisdom you really want to use this chance to pass to our listeners?
Yeah, I would say definitely know that women are unique. So if you feel that your intuition is that your sleep is not as good as where you want it to be, uh, ask your doctor. So start with asking question and ask for help, because a lot of times we can help, and there are things that we can do to help you get better sleep and become a better sleeper.
Great. So resources there, help is there. If other doctors cannot find anything, don't lose hope. Think about sleep also. It's a one possibility. So
Yes.
Dr. Yuan DeClure, I know you just started your own private practice. So if our listeners want to find your practice and seek your help, how can they find you?
Sure. So my website is www.bhai sleephealth.com.
Great. I will put your website to our show notes. So whoever listen to this, and in the description box, so people listen to this episode can find your link also. And I know you speak different language, right? Do you speak Mandarin, English? Do you speak any other language?
I speak Mandarin and English.
Okay, great. So our listeners, if you know anyone speak either of this language, need a sleep doctor, and especially if you have any specific questions about women's sleep health, you can all look for Dr. Yuan Dickler's website to find her practice. Thank you, doctor, for coming to the show today.
Thank you, Yishan. Thank you.
Thank you for watching our videos or listening to our podcast. If you like our show, please feel free to subscribe, like, and share it. If you have any questions or feedback, we would always love to hear from you. You can either email us or leave feedback on our website at mindbodygarden.com or directly under the YouTube video channel. Thank you very much for your company today, and hopefully to hear from you or have you with us next time.